So welcome everyone, and thank you very much for joining this concurrent session room, which will be focusing on the topic of using digital tools to help unlock potential and strengthen health services. As you know, concurrent session brings together diverse professionals, experiences, and perspectives, and we examine new research and evidence and strategies, as well as practices, in order to engage with peers and emerging issues. So we encourage you all today to be actively participating, to ask questions, to share ideas with our presenters, and please use the chat box if you have any questions, and share with us your reflections during the presentations, and feel free to share your comments in the chat box. We will kindly ask you to keep your mics muted and also your videos off as participants. And if time allows, you can be given the floors for questions later on. And we will be introducing now the first session. As you know, this session will be having two sessions of 30 minutes. So the first one will be about telehealth and COVID-19 lessons learned and the path forward. And we will have the pleasure, Pamela Shiran with us. Pamela joined Smile Train since 2007, and she currently oversees Smile Train's global efforts to enable comprehensive cleft care for Smile Train patients and families. She has been working with different organizations in collaboration with WHO, the World Dental Federation, and she has been using a lot of technologies. So it's really the topic of her expertise. So Pamela, without overdue, to you the floor.
Thank you so much, Sad. It's wonderful to be here, especially coming off of that great opening session. A big thanks to the core group for organizing this really wonderful 2 days. And again, I'm really proud to be here and to present and to share with you also, most importantly, my colleagues that will go into more detail on this really important topic. So as was said, my name is Pamela Sheeran, and I represent Smile Train. We're a global children's charity whose model is to empower local hospitals as partners in providing free cleft surgery and essential cleft lip and palate services for families affected by cleft lip and palate, of course. With me today are colleagues to help share a well-rounded story about how telehealth has been an essential tool for offering ongoing care that families need affected by cleft. While many of you may not work with families affected by cleft, we hope this presentation can support you in two ways, mainly two ways. One, that you have a general understanding about what's involved with cleft lip and palate care, and you're empowered then if you meet someone in need of care, how to refer them to Smile Train and what services that we're able to offer them. And two, you're able to learn from our local experience, good and bad, about offering telehealth in this particular time and also moving forward. And that can be hopefully helpful for your services and the work that you do with marginalized populations as well. So our panel includes another colleague from Smile Train, Kimi Castanang Fabiano, who's an area director for Southeast Asia. She's based in Manila, so it's quite late for her right now. We have Dr. Daniel Mena from Lima, Peru, who represents a local partner of Smile Train named Misión Caritas Felices. He's a clinical psychologist. And also we have Bertha Tendo, who's a clinical nutritionist at one of our oldest partners named Corsi Rehabilitation Hospital in Kisumu, Uganda. It's quite late for her too. So big thanks for you all for joining. Now, before I pass the floor over to my colleagues, let me just get to the next slide. I do want to provide an overall picture from Smile Train about our global programs and how we've adapted quite rapidly, really, since March of 2020, when COVID pandemic really hit our global programs. As you can see in orange, cleft surgeries, which are a major part of our global programs, and they're also an elective surgery, they came almost to a standstill early in the pandemic. We urged partners to listen to local policies and stay safe. We awarded more than $2.4 million in emergency PPE, equipment, and hand washing stations for our partner hospitals most in need. We very quickly started a regular weekly email where we sent the latest information, protocols, tips from medical associations around the world to our global partners. And then we also developed with our global cleft experts protocols on how to resume surgery safely when local situations permitted. But as you know from your own work, just because COVID hit doesn't mean that then the need stopped. Children with cleft lip and palate are born every day, every few minutes. And surgeries were coming to a standstill, the waiting lists were growing, and also the need for comprehensive cleft care was growing, and not much more rapidly. young families with newborn babies affected by cleft, they wanted to learn what was going on, what would happen for delayed surgeries, what would their care look like. Children who were in this circle of care that you see on the screen, all these different services that children with cleft typically really need access to in order to receive full rehabilitation. They were wondering, when can I go back to speech therapy? When can I continue my dental and orthodontic care that I've been working so hard at maintaining? My psychosocial services that I need. So it was really, the need was growing. So for many organizations like Smile Train, telehealth became a lifeline. We wanted to offer our partners a way to be empowered to continue to serve the families that they have in their program, to offer this circle of care that's so essential to make sure that, again, children with cleft have access to full rehabilitation. So how did we shift to telehealth? Well, we created a new grant program. We streamlined a grant program so that we could get funding at the door to our local partners so they can offer telehealth services. This funding covered services such as phone and internet cards, transportation, mailed home materials, professional time, and other items as well. We developed a simple reporting metrics, and we encouraged all of our regional staff members to adapt to needs locally and let us know what type of grant, how the grants needed to be changed and altered to keep up with the needs on the ground. And with this technique, since the start of the pandemic, we're very proud to report that we've supported more than 24,000 sessions of telehealth that range from a variety of services such as speech therapy, nutritional support, breastfeeding guidance for new mothers, pre-surgical consultations, and psychosocial care, and to more than 9,000 patients and counting. Smile Train has organized and teamed up with prestigious medical organizations and associations to offer hundreds of quality training opportunities, webinars on the latest techniques of cleft care to our global partners and even new medical professionals interested in getting involved. And we've also developed libraries of online education content for patient families so they can access them at any time outside of even the telehealth services that they're receiving. So many partners have said that telehealth really enables them to make sure that they're reaching even more patients than what they would have normally, that they're offering this circle of care to actually more patients than they normally could. And now as certain parts of the world, more in-person care is resuming, other places it's shutting back down again, unfortunately, as many of you know. But as things begin to change in the future, telehealth is here to stay, as we all know. It's really something that is an asset to help us overcome geographical and financial barriers, increase health system resiliency, and create sustainable environment for the prioritization of children and adolescent health. So now let's invite our first panelist, Batha Tendo, who's our clinical nutritionist from Corso Rehabilitation Hospital in Uganda, to tell us more about how she was able to adapt her program, her nutrition program, in a very for a very marginalized and needy population in her community. So thanks. Without further ado, here we go over to Batha. Here you go, Batha.
Okay. Thank you very much, Pamela, for that wonderful introduction. My name is Batha, like Pamela has said, and I'm a nutritionist working with Corso Rehabilitation Hospital in Chisubi. That's in central Uganda. And like Pamela has said, the telehealth innovations have been a lifeline for us in our center. And when 19 came into the country, we were not prepared. We didn't have an idea of how to adapt to this. And among the challenges that we experienced was the very poor internet coverage, especially in rural areas where a bulk of our patients come from. And a number of our patients did not have access to smartphones or minutes. And to compound all that, we realized as a hospital and as a unit that some of our patient contact information was outdated, and some had given us contact numbers of mobilizers. They did not have phones on their own. So when COVID-19 kicked in, when the lockdown measures implemented by the government kicked in, we were not prepared. However, we tried our best to adapt. And some of the successes that we had was that the hospital, we already had hospital phones and had with patients and trying to find out how they were doing. And some of them, we had offered our contact numbers during the outpatient visits or the inpatient rehabilitation treatments. So most of them kept calling us and asking us, when should I come for follow-up? When is my surgery going to be done for my child? However, we continued offering services, especially over the mobile telephones. This was really helpful. We were able to give nutrition advice, depending for different stages, maybe for children infants who are below 6 months or those who are above 6 months. If a child reached weaning age and the mother had not known what she was supposed to do, we were able to offer this advice via telehealth. So it was really a lifeline. And for us as the nutrition unit, the services continued. And then another way that we tried to reach out to the community was we developed radio messages about IYC's infant and young child feeding messages that were specific to cleft infants. And these mainly aired in the central and the eastern part of the country. And then for the patients that had smartphone, the WhatsApp was a very good, innovative tool. And
we may have lost Bertha's sound for a moment. Bertha, we can't hear you. Maybe you want to try cut. Oh,
have that Can you hear me now?
Yes, but you know what? Maybe let's shut off your video just so we can make sure we hear you super clearly.
Okay, let me switch it off. Can you hear me now?
Yes,
Hello?
we can. Yes, we can hear you perfectly.
Okay.
Thank you.
Okay, so yes, thank you. Yes, so we want to capitalize on the use of online platform like Zoom to train rural health workers in nutrition management and rehabilitation. Just like Pamela said, we're among the nutritionists in this center. We're among the cohort that was able to attend telehealth cleft lectures, whereby we're able to keep building our capacity and learning new knowledge, even during lockdown, even while we were home. We were still able to have information and to learn and to gain new knowledge. And then we're also looking at empowering caregivers and our community mobilizers by training them to conduct simple anthropometry like the mid-upper arm circumference, which can be done in the communities so that they don't have to come to the center itself. And then I believe the continued use of radio messages is very pivotal, and it's very important, and it will reach even those without smartphones or those that cannot be able to call. They'll still have information. And then we also realize that some caretakers may not be having airtime to reach us when they need to. So airtime vouchers can be very important. And we also think it's very important that there are simplified visual information, education, and communication materials that can be availed to the caregivers via social media, or even those that are able to come to the hospital, and also on social media platforms. Thank you very much.
Thank you so much, Bertha. Those are great lessons to take forward from the experience. And now, sadly, we will be ready, for the next wave or for the next pandemic, which is great that we'll be ready. But on the more positive side is we're ready to just reach more patients that otherwise would be a challenge to come back and forth. So thank you so much, Bertha. And now the next presentation is coming from Dr. Mina from Lima, Peru, who's a clinical psychologist, again with our partner from Misión Caritas Felices. Over to you, Dr. Mina. We can't hear you, Dr. Mina. I think you're on mute. Let me No, we still can't hear you. We still can't hear you. I'm going to ask you to unmute. Here you go. Let's see if that works. There you go.
Okay.
Perfect.
Welcome from Peru. My name is Mena. I am a clinical psychologist. And as you know, I work for Caritas Felices, Happy Little Faces mission, a nonprofit association dedicated to the complete rehabilitation of cleft lip and cleft palate patients in Peru. We perform our work thanks to Smile Train, of course. in all the Peruvian territory. And for this work, we have a very suitable staff of professionals, volunteers, surgeons, and nurses, and language therapists, and nutritionists, and well, clinical psychologists, dentists, yes, that work selflessly. Before the pandemic, we used to perform our work in campaigns in Lima and other provinces. We carried for these people diagnosis and information and surgeries, of course, and well, pandemic has changed our activities dramatically. But telehealth, well, telehealth is not the sign of pandemic. Telehealth is the present and the future. As Pamela said, yes, is here to stay. And we have a very dynamic work with social media and chats in Instagram, and of course, WhatsApp groups with patients and their families, and talks with discussion and workshop via our Facebook page. Of course, it has grown a lot since March in 2020, and of course we hope it's going to be more and more dynamic. It's our more important tool in this moment, because maybe you know Peru is one of the most affected countries in the world with COVID-19. And all the medical centers and hospitals are dedicated to the pandemic, to attend to treatment of this so many sick people. Well, and then we are trying to preserve, to keep the link with patients. Yes, video call and cell phones. Of course, nutritionists and psychology and language therapy are using this means because it's very important to preserve the link with the patient and encourage them, you know, enliven to wait for the surgery. Yes, it's going to take a time. It's real. But they deserve these services. Normally, it's people that maybe they were going to receive this help ever. It's important to take this because the poverty line in Peru is growing after pandemic. Yes, it's very hard to understand this new scope. I think pre-surgical treatment is going to be more important, and I think telehealth is going to improve their medias, and it's very important for us to continue with this. I have to confess, and I use this because this frame is, this format is special. Children's psychology is a very special scope in clinical psychology. I am not a children's psychology, but I have some patients, little patients, 6, 7, or 8 years old, and they are in language therapy. And they confess me, sometimes they feel boring repeating exercise, but it's very important. I ask a friend to help me because it's not easy. Yes, my friend is Nino the rabbit. Nino the rabbit is here to encourage children. And Nino the rabbit, oh, my friend, Nino the rabbit is trying to preserve the enthusiasm of these children. Yes, I use this tool. Yes, I use a tool with to reach the feelings of little children. Yes, our language therapists are very suitable, but sometimes you understand a little children are born and they need to be supported. And well, it's a media. And telehealth made it possible because this frame, yes, this special presentation made it possible. Well, I think thanks to
Thank you. Thank you, Dr. Mina. That was wonderful. That rabbit, I'm sure, makes the children feel very comfortable to open up and to express themselves and to continue with their ongoing care with you, even when it's remotely. So that's wonderful. Thank you for sharing that and for your perspective and, of course, for all your work. Great. So without further ado, I'm going to pass the mic over to Kimmy, who's another Smile Train staff person, but she's based in Manila, overseeing our programs there. Kimmy, take it away.
Good evening from the Philippines. I just wanted to share that on March 15, 2020, the entire country was put on lockdown. And at that time, we didn't really know how long it was going to last. Today, 10 months later, we are still on what is known as the longest lockdown in the world. While we were all caught by surprise and unprepared for what COVID-19 brings, we had to kind of immediately figure out what to do. We had hundreds of parents and patients sending us messages asking about when they can get surgery, how they can see an orthodontist, where they can continue their speech sessions. And 10 months later, we're talking about 3,000 or 4,000 children waiting in line. Prior to COVID-19, speech language pathologists or SLPs in the Philippines were very few, with just over 500 practicing SLPs for a country of 110 million people. Even for private patients, it was very difficult to get a schedule. COVID-19 saw the closure of clinics and face-to-face sessions were impossible. And this is where we saw an opportunity. With the help of a handful of dedicated SLPs, Smile Train launched our telehealth program. 2 weeks after the lockdown was imposed on April 1st, Smile Train organized a Facebook Live discussion about the importance and the role of speech therapy for those born with a cleft. And this discussion allowed us to reach as many patients and parents as we could, or at least those who have access to the internet. This discussion, along with others about speech therapy, streamed on our social media sites and collectively reached over 150,000 Facebook users. Patients who received cleft palate surgery 3, 6, even 9 years ago, who never saw an SLP in their lives, were now given an opportunity to receive speech therapy. Patients who lived in far-flung locations where no SLP practiced could now receive sessions even on a daily basis. And where possible, we also provided phone cards for both the SLPs and the patients to help with connectivity. We have one patient, Chris, who lives in southern Philippines. She's 22 years old now, but received surgery for a cleft palate when she was 16 and never saw a speech pathologist as there was none in her hometown. After 6 months of telehealth sessions that ran 3 times a week after her work hours, she's now booming with confidence. She's an inspirational speaker, a Smile Train advocate raising funds for programs, and is now mentoring a group of adults who were also born with a cleft. So from April 1st to December 31st, 2020, Smile Train Speech Telehealth Program in the Philippines alone treated over 100 patients, providing them with more than 700 sessions. And this is more than double the number of patients who received speech treatment during the same period in 2019. For many years, we were thinking, how do we help patients get access to speech therapy? We had to face challenges like there were no SLPs in their hometowns, they could not afford weekly travel to and from the clinic, or no one could take the child for the sessions because they were simply tied up with other responsibilities. Little did we know that the pandemic would bring us the answer. While telehealth sessions do have limitations, we know there are still thousands of patients, for example, who have no access to the internet or a gadget. It certainly paved the way for us to innovate and think of other ways to reach them. A combination of a variety of solutions, including telehealth, will ensure that children and adolescents with special needs do not get left behind, especially during a global pandemic. And Smile Train is grateful for all our speech partners who made all this happen so quickly and the donors who continue to support her. Thank you, Pam.
Thank you, Kimmy. I wish we could have showed a video of Chris, that patient that you're referring to, who progressed so well through speech therapy, through telehealth speech therapy. We all were watching the videos, and honestly, there were some of the darkest weeks in the early times of the pandemic when no one knew what was going on. It was so scary, and we were getting these videos from the Philippines, and they were just completely uplifting our spirits, inspiring us to really continue to try and grow our telehealth program. So thank you, Kimmy, for making that possible and making those connections that could happen and inspire us all. It's just incredible to watch Chris now today continue to be such an advocate for psychosocial health, for speech therapy, just for cough patients in general. Whew. Yeah, so that's our presentation, but we want to make time for Q&A. We started a few minutes late, so I don't know if we have a few extra minutes for any questions from anyone joining us online.
Two minutes for that. So
okay.
One question from the audience, if there is any, you can write in the chat or raise your hand.
While we wait for a question, I do want to also point out something, and I'm going to continue to ring your bell, Kimmy. In the Philippines, the online sessions that Kimmy was talking about with Facebook Live, something that was really neat and innovative, I think a cool lesson to share is that we have some local celebrities in the Philippines that help spread awareness about cleft, and one of them is the woman who was Miss Universe, right? And or Miss Philippines in the Miss Universe, and she joined a few of the sessions to encourage the patients to keep with the speech therapy online. And it really helped inspire the patients and inspire more patients to learn more and to join these online chats. So that was a really neat takeaway too. I don't know, did any questions come in? I'm not seeing any pop in. So I don't want to take away too much time from the next panel as well, but we all can stay on in case more questions come up as the session continues. But thank you so much for this opportunity to present. And again, for people to learn about Smile Train, for you to know if you do come across a family affected by cleft, not just surgery, but all the comprehensive cleft care services, how they can go to Smile Train to find one of our local partners for care. And also some of these takeaways around telehealth will be helpful for your work with marginalized populations. So thank you.
Thank you very much for really the inspiring presentations to all the speakers. And now that we have seen how telehealth and technology can really play a role in our COVID times and to unlock the potential of adolescents, without further ado, I would move to the second session, which is really another inspiring session with some really exciting speeches and presentations, which will be now discussing the use of digital technology to help bridge the disruption and the gaps between care during a pandemic. So we will have Caitlin with Caitlin Agustin, who is a lifelong volunteering and STEM activist who have been involved in multiple NGOs and organizations, and who is today the Senior Director and Product Manager of Data Kind organization. So Caitlin, to you the floor.
Excellent. Thank you so much. And thank you for the excellent first panel. I think it's a great segue to talking about digital tools, both telemedical and other interventions that our panelists will be discussing. Good morning, good afternoon, and evening to everyone attending either now or watching the recording after the fact. As mentioned, I'm Caitlin Augustine. I'm the Senior Director of Product at DataKind. We're a global nonprofit focused on using data science, machine learning, and AI in the service of humanity. And it's really humbling to say that DataKind has partnered with all three of the organizations on this panel to help just unlock greater community impact by using data science to support their existing interventions. For maternal and newborn childcare, from maternal and newborn childcare to expanded programs on immunization, the current pandemic has really disrupted the ability of healthcare systems around the world to continue to provide routine preventative care to the most vulnerable. Our panelists today have taken to telemedical care, remote symptom assessment, digital learning, resource optimization interventions, and many more just innovations to address these unexpected and far-reaching changes. And it's really just so inspiring. Each of these organizations, Jacaranda Health, UNICEF Uganda, and Riders for Health, they have really ensured the continuity of care provision in their communities. And they have demonstrated just excellent leadership and innovation in the digital health sector during this unprecedented time. And with that, I'll plan to introduce each panelist as they come on for a quick 5-minute overview of their organization, and then collect audience questions throughout. And my hope is that we will have about 10 to 15 minutes of Q&A at the end. But I hope that isn't where we stop this conversation. Please keep it going on Twitter and by email as well. So with that, I am going to introduce Jacaranda Health. So Jacaranda Health is a member of the Innovations in Healthcare Network. They're based in Kenya and operate the SMS-based prompt messaging platform. And due to these many digital innovations that Jacaranda Health is really at the forefront of, their reach doubled in 2020. They have reached over 350,000 mothers and over 190 healthcare facilities supported. Jacaranda Health has a focus on care provision, reducing misinformation, and using digital technologies to directly reach their target populations. With that, I'll hand it over to Sathi to tell a little bit more about the exciting work that Jacaranda Health is doing.
Thanks, Caitlin. Yeah, so as you mentioned, Prompts is a digital health platform. We connect moms to care at the right time and the right place. The way it works is they sign up at health facilities or in the community. They can ask questions of the platform and get answers. They get information about their pregnancy or their newborn. And what happened when the pandemic started is, we've seen these sort of waves of changes that we've had to adapt to in terms of prompts. So the first one being, the immediate response, moms are texting in saying, we're having a lot of, like, what should we do? There's a curfew on, should we go to the facility or not go to the facility? Will COVID affect my baby or my pregnancy? And so we're providing like immediate responses and qualified responses to those questions. And that shifted to facilities, themselves not knowing how to respond to COVID, maybe turning away pregnant moms or shutting down high-risk clinics. And we started building in referral support for the moms to say, okay, you can go to this facility, it's open, you can go to this one for high-risk care, to the point where we even then developed digital support for the moms, what we call teletriage, which is kind of a low-tech version of telehealth, where moms could screen through a virtual appointment so that they could know, okay, well, I've missed my appointment, here's what I need to do instead, here's when I absolutely need to go to the clinic, even though there's a curfew on. And now, 9 months in or 10 months in, we're seeing the indirect strains of COVID on the health system, unfortunately seeing a lot of service disruptions and healthcare workers strikes. And we're having to adapt again to provide referral support to moms to say, okay, these facilities are open. Here are private facilities that take public health insurance. Also seeing the result of the spike in teen pregnancies and being able to support adolescent pregnant mothers who are messaging us on the platform. So lots of different waves of changes that we've had to deal with that we've tried to adapt and support through digital support.
Thank you, Sathi, for the overview. And before I hand it over to Simon and Writers for Health, I'd actually just like to ask you a quick question of, what can others take away from Jacaranda Health's experience? As DataKind knows, you're really on the leading edge of the work using these chatbot and SMS-based communication systems. How can others listening to this learn from and take your solutions forward?
Yeah, I would say the best approach is to get low-tech, potentially hacked together solution out there so that you can learn if it's responsive to your user needs and then adapt accordingly. There were things we tried that didn't work. For example, we were putting up digital fancy dashboards for our health system managers that were beautiful and used maps, but we quickly realized people didn't have the bandwidth to look at maps, and they actually wanted verbal cues in terms of what's going on, here are the disruptions, here's the list, here's what you need to do. So, it's important to try and quickly get feedback so that you can iterate on your solution. So that I think is the most important lesson we've had over the last 9 or 10 months.
And I have to say, I think that's such a great lesson because often we get married to a solution and we don't see another way forward. I want to now hand it over to Simon, who I think can actually really piggyback on that. So Simon from Writers for Health. Writers for Health has been around since 2009 and are no strangers to innovation. They began by answering a challenge of how can we do medical sample transport in these areas that have very little formalized medical sample transport, frankly, very little like standard roads or roadway access. And they began to respond to the demand for community HIV testing in Lesotho by using riders primarily on motorcycles to help fill that demand and to implement a ministry testing program. Their innovations were subsequently scaled to multiple countries, including Nigeria and Malawi, and they were part of the emergency response in the Ebola outbreak. Riders has really shown how transport and logistics are vital to enabling access to care, and they have continued to innovate and pivot over the past decade of innovation. So to Sathi's point of learning what works and doesn't work, Simon, I'd love to hand it over to you to talk a bit about how Riders is responding to the current pandemic, and perhaps even what have you learned from your previous experiences?
Thank you, Caitlin. So basically, Riders for Health is an African-led international NGO and is a not-for-profit social enterprise, and it was established actually over 30 years ago. We were working to improve the capacity and efficiency of government and non-governmental healthcare delivery organisations across Africa. We're world leaders in the management and maintenance of vehicles for health-focused activities, and this is what underpins all our work, fundamental to what we do. We work in Lesotho, Malawi, Nigeria, the Gambia, and Liberia, as you said, and we have around about 700 staff and approximately 1,500 vehicles, and about 2/3 of those are motorcycles because of the terrain and the places where we try to reach. The health services we deliver are built on a foundation of high quality fleet management, because we know that specimen samples, vaccines, and mosquito nets are very effective in preventing illness and death, but they don't just appear in the rural communities. Somebody has to physically get them there. So therefore, we provide health services that are with the foundations based on vehicle maintenance, scheduling and service reporting, vehicle replacement parts and stock management, motorcycle rider and all-terrain driver training for challenging environments. And then the health-focused activities we provide using these, and also now supporting COVID-19, are sample transportation for infectious substances, emergency patient transfer, medical supply chain logistics, and then outreach health workers delivering essential public health interventions such as health promotion, immunization, nutrition, WASH, communicable disease control and monitoring, and ARV patient monitoring, to name a few. So in 2009, Riders was approached by the Clinton Health Access Initiative to design a sample transport system primarily focused on HIV and TB for Lesotho. This system has now been expanded to Nigeria and Malawi, and has also been set up under invitation by the government of Liberia to respond to the West African Ebola outbreak in 2014. It was at this time when we started to introduce digital solutions to complement and improve our work. So as Riders was founded over 30 years ago, paper-based recording systems were all that was available to us. But with advancements in digital technology and expanded communication networks in the countries where we operate, Riders is now able to build on its award-winning vehicle management systems for healthcare delivery to develop and adopt innovative digital technology to continually improve the quality and the scale of the services we deliver. So to give you an idea of the different digital tools that we've started to implement, some of them we're piloting at the minute and others are in the development stages, are things like mobile data collection, and we would use this for, say, sample transportation to track and trace samples. Also optical character recognition. This is to basically speed up processes where you would take handwritten documents and digitize them into a format which can be quickly sent to the office and can be worked on there. Vehicle trackers, because of the remote locations we're working on, and the different difficult and challenging terrains, obviously part safety for our drivers and couriers, but then also we can use that information for another technology we're bringing on board, which is route optimization, to make sure we do everything as efficiently as possible with the vehicles we're moving around. With those things, we're moving into more of a visualization of the data for both the operations, daily operations, and also for monitoring and evaluation of our systems. And things, because of obviously restrictions on travel, both in countries and internationally, We've obviously had to move to a lot of online and video training, and also moving more and relying more on messaging apps as well, just to keep that connectivity going, both in the field and cross country as well. So the aim of these is to integrate these digital systems across all our activity areas of our operations. It's a big task, we know that, but with the backing of our team members and also our partners, such as DataKind, you know, this is a challenge we're definitely looking forward to meeting head on. And just to pick up on your point there, Caitlin, about what, you know, sort of the takeaways are and what the lessons learned across the digital intervention space that we're trying to create. I would say that because riders deliver health-saving services on a daily basis, we had to recognise and mitigate against any risks the inclusion of any new technology and processes would bring, particularly with downtime and information management. For riders, as a multi-country organisation, a digital-wide transformation needs to be developed around and with the people who use the technology, rather than the technology itself being the primary focus and leading as a driving force. I would say that any step change in management and operational activity needs to be people-centred. As I said, we've got a lot of staff, and we also work with a lot of other partners across all our different countries. So everything we need to do needs to be people-centred. Because obviously a big part of moving to the digital side is also a personal behavioural change and acceptance of the new technology. And these are the key factors to success. I would say a couple of other quick components that are key to this is to be flexible in managing setups, piloting and deployment of new initiatives, particularly with external influences like COVID has had upon us, which could obviously dramatically change timings of plans. Communication is also key, particularly when dealing with cross-country coordination and differing time zones. Engagement of all stakeholders from the beginning, and most importantly with the people who will be using the new digital tools, as it's essential to avoid dead ends and disappointments, and also manage expectations about what the tools will actually do. Monitoring and feedback for all stakeholders to keep everyone informed of the plan is key to keep the momentum going of the project, and also because it's an exciting new thing, very key that we make sure that everyone's involved. And this is done through continuously evaluating, looking at lessons learned, and constantly improving the plan. And with all that, we need to be agile and always look for new opportunities and innovations as they appear, because whatever we're putting into place now, people are bringing on new technologies all the time. So we've got to make sure our eyes are open to what's available in the future as well. Thank you.
Simon, thank you for that, and for really going right into answering a couple of my questions and really setting up our next speaker so perfectly. I'm going to invite our third panelist, Jessica, on the line to talk to us a little bit about work that is being set up in Uganda. So Jessica comes to us from UNICEF Uganda, and they recently stood up a multidisciplinary partnership to support the Ugandan Ministry of Health to use data to strengthen their community health systems. They are looking at this at a national level and building strong partnerships across the government, private actors, and public actors. So a really excellent setup that Simon provided of how Riders for Health is doing this. Handing it over to Jessica to really discuss a little bit more, how do you build those partnerships? How do you bring those organizations together? What are some of the lessons that have been learned in this process for the UNICEF team? So with that, Jessica, I'd love to hand it over to you.
Thanks, Caitlin. I wasn't sure if you were going to share the slides, but that's okay. So let me just put everything in context. I'm the community health specialist at UNICEF Uganda. And as part of our engagement with the Ministry of Health, and in particular, the Community Health Department, we are helping to support the Ministry of Health in implementing the Community Health Acceleration Roadmap. This is a bit of an offshoot. It was launched in 2019. We received funds from the Rockefeller Foundation as part of something called the Intelligent Community Health System Initiative. So as COVID has disrupted all of us, one of our initial data science partners called Dalberg Data Insights came on board around April of last year to really help transform. And I think my colleague from Ryder said this, was quite agile in their engagement in a way such that they could initially think about how to look at mobility patterns to help with the COVID response, yet that wasn't really the necessary question. One really important question was, how do we ensure service utilization? And so the data scientists from Dalberg Data Insights were able to use routine health management information data and create very granular visualizations that would support, even at the subnational level, with health facility level information, around 100 plus indicators that come from the health management information system, to be able to support and show where you were seeing traction, where recoveries were happening. For example, in the beginning, when we had the lockdown measures from COVID, there was a real decline in outpatient attendance and subsequently in most indicators. And then over time, over the course of months, the ability to see improvement and recovery in those specific indicators. So I would say that partnership is very important, and engaging with private partners as well. We're just launching a consortium that's led by Living Goods, again, a significant leader in community health here in Uganda, along with BRAC and Medic Mobile, and also with DataKind, who's going to be supporting us with data analytics. And the idea here is thinking about bottleneck analysis and going down to the community level. And again, it's been spoken about here already, but a user-centric design. So ensuring a lot of key informant interviews, a lot of focus group discussions, to be able to understand what are the real challenges that are resisting uptake of a resilient community health system. And then using that knowledge that's gained to develop specific use cases. They may center around integrated community case management. It may center around the COVID response, as we're seeing that the village health team and other frontline health workers need to be responsive, because they are now, seeing patients that will require transition to a health facility when they become more symptomatic or require more acute care. So all of this, I should say, is centered upon a foundation of a very strong incident management structure of the Ministry of Health. There's a pillar called Strategic Information Research and Innovation, where all digital, health automation that's coming in to support the COVID response must go through. And so that's sort of the gatekeeper for digital tech to respond to the health system questions around COVID. And then using that with our partners from CDC, from WHO, private sector partners like I've described in the new consortium that we're bringing on board, to be able to answer questions that are important to the end user. So whether that's a district health officer, the district biostatistician, or the VHT, the village health team, frontline community health worker, him or herself, to be able to grasp the data that's being provided, in this case through quite intensive and granular level visualizations to help with decision making at the facility or at the community level, or just certainly a need to sort of step back and think about what the problems might be in ensuring vaccine rollout, for example, and how to do that best using incident management structures and the village COVID task forces that have recently been set up as part of the government's community engagement strategy. Maybe I can just highlight what my predecessor said on the call, which is really ensuring that any digital technology is as good as the user, making sure that there's use of that technology. And in order to do that well, ensuring that your end user is part of the conversation early on, to be sure that that is integrated into whatever tools are being designed for deployment. In the interest of time, let me stop there. Thanks very much.
Thank you so much, Jessica, and thank you to all three of our panelists. I think there's a really excellent through line about these solutions are innovations born of the communities that they serve, and they must be useful to those communities. And as innovators, we must really continue to learn from the community and to quickly pivot if those solutions are not really working. I'm going to quickly just flash up again. Please continue the conversation on Twitter, but we have a couple of minutes left. And what I'd like to do is to do a round robin of all of our panelists to really give us your closing thoughts. Do you think that the pandemic has changed digital health forever? Why or why not? What is on your mind leaving this conversation, and what do you think the next steps are? So I think we'll just go in order. So I'm going to hand it over to Safi first, and then over to Simon, and then back to Jessica for your last thoughts, your key takeaways for the attendees of this session. And please remember to follow us and connect with us on Twitter as well. So Safi, over to you.
Thanks, Caitlin. I think it's a great question. I think what we've seen is an increasing awareness of digital health tools, increasing openness to trying and testing tools like telehealth, telemedicine, just by virtue of necessity. And that's fantastic. You know, we run webinars on Zoom. We meet with our ministry counterparts on Zoom. That's fantastic and frankly more efficient sometimes. I think what we need to see more growth in is thinking through the sustainability of these tools. How do you incorporate a digital health tool into a government budget? What's the line item? You know, what should it cost? What are the procurement mechanisms? I think this is work that needs to be conducted in the years to come so that these tools are embedded within the health system.
Excellent. Over to you, Simon. What are you thinking?
Yeah, I completely agree with what Safi's saying there. And just to add, I mean, one of the things that we found a challenge at the very beginning was to find where we would get the funding to try out some of these things. And we've been very fortunate that our sister organisation, Two Wheels for Life, has been basically supporting that funding up front, so we can explore different ideas and put things into place. Particularly around piloting and things like that. I was just like to say that I think one of the key things is as we move the communication, particularly to things like Zoom, maybe more messaging apps and things like that. Obviously, that takes a slight shift in how we may do our normal, more traditional kind of meetings. So it's how those meetings are best set up to get the most out of it and to make sure that everybody goes away from it with a full understanding of how you would do in a meeting where you can have more, more kind of nuanced conversations and things like that. So yeah, I think it's certainly here to stay, and I think it's something that clearly both this panel and the previous one are embracing very well.
Great, continuous theme of innovation and growth here. Jessica, what would you like to add to these last thoughts?
Sure. I think really it's also about leveraging partnerships, which we talked a little bit about before, and that's ensuring that resource mobilization, we all are working in a resource scarce setting, but ensuring that, for example, if the Global Fund is coming into Uganda to help support digital tool technology, that we can support the Ministry of Health in that coordination function to ensure that we're leveraging those same resources. So it's very difficult, I think, for digital technology to come into play and go fully at scale. But in order to sort of mitigate pilotitis that we've all heard so much about and just have very small projects that are functioning in one part of the country or another, but coming together with our ministry leadership to ensure that we can actually leverage resources and where they are. So we're having discussions as part of our Living Goods Consortium, where DataKind, Medic, and BRAC are a part of. And we did this the same with DDI. And again, with all partners sitting around the table at that CIRI pillar in COVID and beyond as part of the technical working group that is on all issues around digital, so that we can be sure that we find out where other resources are so we can piggyback on them to be able to develop solutions at scale. Thanks.
Excellent. Well, I really want to thank our 3 panelists calling in from 3 different countries. Thank you for making the time zones work and for really sharing your knowledge here. To all the attendees, both live and watching as a recording, we hope this really is the start of a conversation and that you come along this innovation and scaling journey with us. So please engage with us on Twitter. Feel free to reach out to our organizations by email. And we look forward to seeing you on the front lines of healthcare. So thank you, everyone.
Thank you very much, Caitlin, and thank you again to all the panelists and presentation for the first and second session. Well, it was really an inspiring session, especially for me as a young person interested in digital health and seeing its potential to overcome COVID, to overcome all the challenges that we have, and how with partnership and collaborations, we can really use it as a tool to unlock the potentials, especially for adolescents' health. So thank you again for the session and for all the participants for joining us. And with the time being over, I would kindly invite you all to go back to the conference website to enjoy our very interactive and engaging marketplace sessions. And have a nice day.
Thank you.